A hearty good afternoon and welcome to our session on minimally invasive procedures. We're glad to have Dr. Vindhya G among us today to help us explore this topic. Minimally invasive procedures eliminate complications and trauma of open surgeries. Now, minimally invasive surgeries, also known as advanced laparoscopic surgeries, cause less pain and don't require a hospital stay. Since this approach is becoming more and more common for more major surgical procedures, we would like to take the opportunity to inform you more on this topic. So, Doctor, you have the stage.
Good afternoon, everyone. Myself, Vindhya Gameraju from Apollo Cradle. Today, I am going to explain you about the minimal invasive surgery. What is the newer innovation in the minimal invasive surgery? How it is different from the general method, that is open method, and how it is different from the traditional minimal invasive surgeries. So, the new procedure which I am going to tell you about is the V-nose procedure. V-nose stands for Vaginal Natural Orifice Transluminal Endoscopic Surgery. This is the advanced to the minimal invasive surgeries. So in this procedure, we go through the vagina and we operate for the uterus, ovaries and tubes. In this procedure, we don't give any incision or any cuts on your tummy to enter into your abdomen. In this, we enter through the vagina to enter the abdominal cavity. Therefore, you don't have any scars or incision over the tummy, and this will help you to recover back very fastly. Initially, I will give you brief introduction about this procedure. So initially it was done in animal models. Later it was started in 2014 in by Jane Beckenlard in Berlin, and then they have proceeded by the Koreans and all those people, and they have done a vast extensive research on this, and they produced that this procedure is better than the traditional minimal invasive surgery, that is the laparoscopy, and they provide much benefit in recovery, and there will be pain will be very less compared to other procedures. So when we are talking about this venous procedure, initially this was done by the gastroenterologist, but later it was developed by the gynecologist. So this procedure, as I told you, it starts through vagina. So there will be no cut on your tummy and there will be no pain at all. Now I am going to tell you what type of surgeries can be undergone through this procedure, and what complications you may face this procedure compared to other procedure. Coming to this procedure, as I told you, we will give you incision in the vagina. That's a very small incision and we enter the cavity. So when we enter the cavity, we can get access to the uterus, ovaries and tubes. So many people nowadays facing problem with the heavy menstrual bleeding, or they have a fibroids for which they have a bleeding and pain, adenomyosis where there will be a severe pain for the patients, and there is a cyst known as the ovarian cyst. Simple cysts are there, sometimes endometriotic cysts are there. All these things are problems where you require the surgery. Coming to the uterus, when you face bigger size uterus with fibroids, adenomyosis, and when it is not heavy menstrual bleeding, which is not getting controlled with your medications, then we will give you an option for the surgery. For that surgery, you can have an option of V-nose procedure. This V-nose procedure, where we give you incision in the vagina, there will be no incision on the tummy. Coming to the other procedures which I told you, we can operate for the ovaries and tubes. For the ovaries, when there are cysts, when the cysts are there bigger than 5 centimeters and which is not regressing with the medication, and when the size of the cyst is increasing, which is causing you hormonal imbalance and heavy menstrual bleed and pain, those cysts need to be removed. For this also, we can do a venous procedure. There is one more cyst known as the dermoid cyst, where there will be multiple elements in the ovary which causes compression and which causes pain also during your periods and normally after the periods also. This also can be removed through the venous procedure. Coming to the tubal parts, when the tube has been damaged or when some people get pregnancy in the tube, that is known as the ectopic pregnancy. These also can be done through venous procedures. In this procedure, we remove the tube or we keep a small hole on the tube and we remove the pregnancy. Depending upon the damage of the tube happened due to the pregnancy, we remove the tube or we keep a hole on it or we remove the pregnancy. One of the other procedures which we can do is we can remove totally the tubes and ovaries when there is an infection, or some people will have genes inherited from their parents or from their grandparents like BRCA genes, which may turn into a cancer. In those people also we remove the tube and ovary, that is known as salpingo-oophorectomy. Those procedures also can be done through venous procedure. So let me explain you what are the advantages of venous procedure compared to traditional laparoscopic procedures. Umbilicus, and it will be around 1 centimeter cut will be there, and there will be small 0.5 centimeters cut around 3 to 4 on your tummy. And in the venous procedure, there will be no cut on your tummy and there will be only one single small incision on the vagina which is not visible at all. And comparing to the pain and the complications, the pain is more in the traditional laparoscopic procedure because we cut the skin, but this pain is very less compared to the open procedure where we open the tummy giving a 10 centimeter incision and doing the surgery. So compared to open procedure, minimal invasive laparoscopy, that is traditional laparoscopic procedure, will have less pain, and compared to this traditional laparoscopic procedure, venous procedure will have a very less pain. The patient will not feel pain at all. There will be mild or dull sensation will be there because where we operate, that is through vagina, is a less pain sensitive, and the sensory nerves which causes pain are very less in the vagina. Compared to the stay and all those things, when you have an open procedure where there is a 10 centimeter cut on your tummy, then you need to stay at least 4 to 5 days. And when you come to the laparoscopic procedure, that is traditional laparoscopic procedure where there will be a small cut, for those people also there may be need to stay for 24 to 48 hours. For venous procedure, generally we are discharging the patients within 24 hours, and their resuming back to the work is also very fast because they have less pain sensation. They become more ambulate, means they walk more, and they start doing their own works very fastly, so they can resume to their work back very fastly compared to the open procedure and traditional laparoscopic procedures. And complications wise, lab open procedure has a lot of complications like excessive bleeding, pain, sometimes morbidity may be there to the patient. Laparoscopic procedure, yeah, because we give you very small incisions on your tummy, that is 1 centimeter, you have a less pain compared to the other open procedures, but there may be a continuous pain, or sometimes you may develop hernia over that 1 centimeter incision, or you may have continuous pain because there will be trocars which we are moving regularly when we are operating it. That pain will be there for you, some itching sensation, some tingling sensation over the abdomen, or some scar formation like keloid formation, and all those things may be there with a traditional laparoscopic procedure. When you come to venous procedure, we don't have any scar and no keloid formation, no trocar related complications. And the bleeding will also be very less because when we operate through venous, we ligate the arteries which supply the blood supply to the organs initially. So the blood supply is initially cut off, so there will be less amount of bleeding. And only one complications which we face in the venous is very rare, that the patient may have after the operation may have little amount of bleeding after 10 to 15 what are the types of surgeries which can be undergone through venous. Coming to the persons who need to undergo surgery, this is venous surgery. Who are the patients who are fit for venous surgery? See, any gynecological procedures like removal of the uterus, removal of the tubes, removal of the ovaries, all those things can be done through venous procedures. Especially, it is beneficial for the short and obese people, like who are very short and they are obese and their BMI is very high, because we have to give them anesthesia. When we give anesthesia in traditional laparoscopic procedure, we have to give them a Tendelberg position where we shift the table down and there may be a compromise for their lungs. But in venous procedure, there is no Tendelberg position and the patient compromise is very, very less. And we can operate this even in general anesthesia, local anesthesia, and spinal anesthesia. So this is very suitable who are facing complications, who are not able to undergo laparoscopy because of the other complications like lung problems and heart problems. In those patients also, venous procedures are procedures are the who already had multiple scars on their tummy, who had already had multiple scars on their tummy for because of previously they had any open procedures for two previous cesarean section, or they had an appendicectomy surgery, cholecystectomy surgeries, and all those patients, and who had hernia problem and who had undergone hernia repair surgeries. All those patients where there is already scars on the tummy and they are increasing chances of further increasing the chances of their developing the hernia may increase. In those patients who are suffering and having the problems like heavy menstrual bleeding where the uterus should be removed, or fibroids where the uterus need to be removed, or ovarian cyst where the ovarian cyst need to be removed, in those patients also we can do venous very safely, and the chance of injuring the other organs also very, very less when we start with venous. Because in the previously operated patients, there will be multiple adhesions which may cause adhesion of the bowel and all those things, which causes further complications to the patients. Coming to the patients who already has BMI more than 40 and their abdominal wall is very loose, where the entry may be difficult, but the entry part through vagina is very easy, and it is more suitable for the obesity patient. As I said to you before, it is useful for the patients who are more than BMI 40, that will help them to avoid the complications due to the traditional laparoscopic procedures. Now I am going to brief you about the what are the differences between the venous laparoscopic procedure, traditional laparoscopic procedure, and open procedure. As I told you before, traditional open procedure will have a bigger scar, and laparoscopic procedure will have a 4 scars on your tummy. Venous no scars at all, and it is most suitable for all the gynecological surgeries, as all the 3 surgeries can be done for all the gynecological surgeries. And venous will provide you more benefits like recovery time is very fast and post-operative pain is very, very less. Patient may not feel pain at all, and the risk of infection and risk of blood loss is less, and hospital stay is very less, and the use of the post-operative analgesia like high doses of narcotics and high doses of analgesics will be very less. We use only 1 dose of analgesic if the patient complained any pain. When you compare this with the other procedure where we need, even the laparoscopic procedure also need analgesia, and open procedure need much more analgesia compared to all these things. So venous is a newer procedure, but it provides more benefits compared to other procedures. Even the cyst tubes which has an abnormalities, all those things also can be done with the venous procedures. In this, venous will help you to recover back very fastly, and it will help you to resume back for the work. as the venous has a very less shorter hospital stay, less pain medication, and almost negligible post-operative pain and faster recovery time, we, itself tells that venous is more superior than the traditional laparoscopic procedures. As I told you before, this can be done for any type of procedure, any type of surgery except for the severe endometriosis, where there is a no vaginal pouch available for us. But rest of all the surgeries we can do, even the small endometriotic cyst we can do. We can remove the uterus which has other problems like adenomyosis and fibroid uterus will all help for you for these things. As this is the advanced procedure which will help you to recover back very fastly, it is always better to give a try for the venous procedure. You can ask your doctor if you are going for undergoing any procedure like hysterectomy or ovarian cystectomy, or if you had an tubal problem where you need to undergo surgery, you can try this procedure. This procedure is totally safe as compared to the traditional laparoscopic procedure, and it is more superior compared to that when it relates to the patient points. Anybody has any questions regarding this? Hello.